Good afternoon. I'm conscious I didn't get to do a blog yesterday, and I sincerely apologise for that, but with changes coming both through the federal and state government in the last 48 hours, it's been a fair hive of activity. But where are we up to? First thing I just want to ask people is, if you're given directives, please can I ask you to follow them, and there shouldn't be any changes made to the pandemic plan or COVID-19 initiatives unless it's actually come through the incident management team. So could I please ask that people just abide by that, otherwise it becomes quite confusing for staff on key information going out, and that's the last thing that we need. We're currently looking at redeployment opportunities for staff within the organisation. A lot of our services are starting to wind back and close down, so we have asked staff to let their managers know around their availability for redeployment. We're also at each of our entrances, as people are coming in, introducing screening for COVID-19 and temperature checks as well. This is both to keep our staff safe. If you do show a temperature, you will be asked to go home, but it's also our visitors and clients presenting to the organisation that we don't want people coming in that may be at risk of COVID-19, and that's why the screening is in place. Our residential aged care services, we've restricted all visitors in there. Now, I'm absolutely conscious that we need to make sure there's social connectedness with our residents and their families, and we're working through that at the moment. That is key, but I'm also really keen that we keep our residents safe and also reduce the opportunity of occupational violence and aggression, which we were starting to see. Visiting hours in acute have also been reduced between 1:30 and 3:30, and that, for obvious reasons, is over double handover time and gives us the opportunity to police who's coming in and making sure that people are well when they're visiting our inpatient services. We're also looking at reducing theatres, and there's a team looking at that at the moment. And we have to have capacity to convert a theatre into an intensive care unit should the occasion arise. So all that sort of planning is happening in the background. I know a hot topic at the moment is people working from home, and I've had a meeting with the Chief Information Officer from SWA and putting things into place so we can start looking at that from an IT perspective, notwithstanding it's on a case-by-case basis, and there is a HR process that needs to be worked through and with your director before that it can actually happen. So please, it is being looked at by each of the directors, and we're going through the IT processes as well. We know that we need to be able to also test our staff for COVID-19, and we're following all the criteria that's been provided to us, and naturally that's at no cost to our staff when we're doing that. We are looking at Medicare rebates. Probably one of the key things I want to talk about is the cafeteria. I absolutely do not want to close the cafeteria, but I also need staff to abide by the social distancing rules, the cough etiquette, personal hygiene, washing hands, and all those sort of things. For me, it's an area that staff can congregate if they honour and respect all those things, because we still need that connectedness as an organisation. So I really do want to be able to maintain that open, but that really is based on staff obviously following the rules around COVID-19 and what best practice is. That's probably the key messages that I really wanted to go through. There is still a mechanism, and will remain in place, a mechanism for staff to feed up, and that comes to the health and the incident management team every day, and is informing the discussion. The notice board just outside of the cafeteria, I've asked Marie Shelley to strip that back. It's the Work Health and Safety one, so we can put our key messages and updates on a daily basis there, things around keeping our staff well, and obviously any other relevant information around COVID-19. So that'll start tomorrow. So if you pass the cafeteria and don't have access to computers and things like that, it's a great place to see hard copy information. Stay safe, stay well, and I'll talk to you again tomorrow.